This was breaking news, and Brianna Carnegie was talking about it on that newscast that Ontario is reporting its highest one-day count since early June, 781 new cases of COVID-19 today. And there is some talk about if this is an airborne, an aerosol virus. I know that the World Health Organization months ago came out and said that it is not. There's some changing opinions on if this is really an aerosol virus and if that's the main way we contract COVID-19. I was reading in the Star last night, and it's a very lengthy article, so I'd love to pick it apart, but quite frankly, too long. And I've got a guest standing by that I think is very knowledgeable on this subject. But the headline, if you're looking to get into it, is Ontario fought against treating COVID-19 as an airborne threat in hospitals and won. With the fourth wave bearing down, was that the right move? And so there is some debate as to whether we should be treating COVID-19 and at least this fourth wave as though it is an airborne aerosol-driven virus. And if that's the case, we still have to mask and hand wash, but we're going to have to do something about ventilation. Earlier this week, you may have heard Sean Stone on the show. He's president of International Electronic Components, Inc. It's a Toronto business. And we were talking about ways that he had changed his ventilation system and worked on improving the air quality in his business so he could keep it going because he's an essential business. And he mentioned the name Larry Gold. Said, you got to talk to Larry Gold. He is an expert on the topic. So we thought, well, you know what? When someone tells us to do something, we're going to do it. So we did. Larry Gold's on the show right now. He's the lead on Bk2B, Back to Business, Safe Reopening of Main Street Pilot Projects. He's been helping to make business aerosols safe in this fourth wave, and he's our guest. Welcome, Larry. Good to have you on.
Thank you very much. Thank you for having me.
So can we start off by just talking a little bit about the pilot project that you're working on?
Absolutely. I'm somewhat of a multidisciplinary individual with many, many different backgrounds, including law. I'm a non-practicing member of the Ontario Bar. I'm a bailiff. I'm a business valuator, and I had a long-standing history in the area of restaurants. And I knew back 1.5 years ago that the industry was in trouble. And the trouble seemed to be emanating from exactly what you just referred to in your prologue, which is the fact that there was developing evidence of the fact that the pathogen or that the virus is airborne. And as soon as I heard that commentary, I saw the article this morning, and my automatic response, Kelly, was, oh no, more churning.
Right. And can I just mention this? I mean, to a lot of people that were following the story from the beginning, right from the Diamond Princess, that cruise ship that was stuck outside Japan in a harbor for ages, where people were just languishing because they weren't allowed into Yokohama, where they were supposed to disembark that boat. And also from a story that was early days of the pandemic. Do you remember the story about the restaurant in Wuhan, where there had been people eating at one table and then someone contracted it in the restaurant and they figured it might have gone. They actually looked at the ventilation system. I thought to myself, okay, well, why do we drop the whole aerosol and airborne portion of trying to mitigate this virus? But it seems that we were looking at contact. We were looking at, spacing each other appropriately and masks and hand washing, which is great for virus control, but we kind of dropped looking at it like an aerosol-driven virus.
I can tell you that every single story that you're talking about, I've followed minute by minute by minute, and includes the restaurant, the Chinese restaurant. Then it went to the Diamond Jubilee Princess. Then it went to choir practices in Washington State. Then it went to our Prime Minister speaking about moistly speaking. And, the bottom line is that it's been a slow movement in order to get the scientific community on board. The scientific community globally is on board, understands that it is an aerosol spread. And all we have to do is look back what happened in Canada back in 2003 when the SARS-1 Commission dealt with SARS, and it was pretty clear, or crystal clear, that this was an aerosol spread respiratory virus, and that there was a need to take what they referred to as precautionary steps. And what that means is, despite the fact that the scientific gurus may still be fighting with one another, you have to take steps and make the assumption that it is aerosol spread, which means that you have to cleanse the air, which is the primary route of spread, if I can put it that way simplistically.
Well, Larry, you said you had a background in law, although you're not practicing, and you've been following this along, and you thought, boy, the restaurants are in trouble when this virus first landed here in Toronto. How did you get into trying to look into air purification? How did that happen?
It was just a function of the fact that I'm by my very nature, my background, although I have all these multidisciplines, I've also been a prolific social justice. We need to step up to the plate in order to organize the community and the public and the private sector, bring the experts together and have them work together collaboratively in order to solve the problem at hand. And this led to the conclusion, and I mean, I could spend hours explaining to you how this developed, but the bottom line...
The show's not that long, Larry.
Yeah. I started working on it, and the experts started approaching and say, we like what you're doing, we want to join on board, resulting in me having a brain trust that is just phenomenal in terms of the type of people who are behind all of this.
Give us an idea of the type of people, just very quickly.
Epidemiologists, infectious disease specialists, people who are former employees of the Public Health Agency of Canada with over 100 years of experience, a doctor who's also an industrial physician, and a engineer who was involved directly in SARS-1 and did testimony at the SARS Commission. HVAC engineers, HVAC remedial contractors, industrial hygienists, you name it, we've got it. From all
okay, well, that's great. And that's great. I mean, you've assembled this group of people that can advise businesses on how to reopen safely and continue to stay open, because I think that's really important in this fourth wave. We'd like to stay open. The economy needs it. Our businesses need it. So it's called Back to Business, Safe Reopening of Main Street Pilot Projects. Tell us exactly, what you guys do and what you are suggesting businesses do. I mean, there's probably business owners that are listening right now that are thinking, I just don't know where to start if this is aerosol driven. I mean, I have I've got the plexiglass up. I've got the hand sanitizer. I've got a masking protocol. What do I need to do?
Yeah, I'm going to avoid getting into what I call all the theatrics of a hygiene theater and mass theater and the whole thing, and just get down to the nuts and bolts of it. The bottom line is that this is not complicated. And you mentioned Sean Stone a few minutes ago. The process is very simple. There's a necessity to have the appropriate expertise come in to assess the premises, to prepare a proper plan for remediation, execute the remedial plan, and then implement some type of ongoing monitoring.
And so when it comes to purifying the air, what are you hearing from the experts, your HVAC experts?
Well, the easiest way for me to explain it is as follows. Doctors know what to do when the pathogen gets into your body. HVAC engineers know how to move air around with a concentration on comfort, which is heat, cold, humidity, and energy saving. It's the people in the middle who are the industrial hygienists in conjunction with the HVAC engineers who know how to consider what has to be done in terms of treating the air that we're breathing. And the bottom line is that the process that they utilize is very simple. And as I said, you have to, and there's a couple of very simple rules. You have to make sure that you've got enough fresh air coming in. You have to have air coming in and going out. And the easiest way I explain it to people is think of a cigar smoker in the car. How do you get rid of the cigar smoke in the car?
Open the door and shove them out.
Well, shove them out, but open one window and open another window. Then you have to cleanse the air. Either it's being done through your HVAC system Or if that's not enough, as in the schools, you have to then bring in a portable HVAC system. But you have to have a plan. And sticking one HEPA filter system in the corner of the room is going to do a great job cleaning the corner of the room.
Really? So this, I mean, to me, it sounds like it's going to be a costly endeavor. I mean, it's important, but how costly is could this get for business owners? And is that why people are avoiding kind of acknowledging this is aerosol driven?
Absolutely. And if you ask the question to the restaurant industry, for example, who are the most exposed, because I don't know about you, but I don't wear a mask when I eat and drink. They are the people who have been scapegoated from the very beginning. But that's an industry, for example, who doesn't have the money in order to take this step. And no steps have been taken to say to the government, excuse me, we need funding in order to deal with the issue of aerosol spread. Not just restaurants, movie theaters, funeral homes. Every single business has the same issue. And unfortunately, I mean, I don't want to get into criticizing government. I only want to speak about what has to be done. And what has to be done is paying attention to aerosol spread and utilizing certain financing models that are out here, leasing plans. It doesn't have to be an expensive endeavor. And the pièce de résistance of all of it is I appraise a lot of restaurants. Most of them are just fine. When I walk into a restaurant that has sitting right in front of me an open kitchen with what's called an HVAC system, an air replacement system, I walk around with a CO2 detector. The air inside the restaurant is better than the air outside the restaurant. Huh. But because of the fact that they're not spending the time to be pre-assessed, when the public health turns around and says, oh, there's been 3 high-profile outbreaks in restaurants in the entertainment district, we're shutting you all down. And they don't have any data to push back but say, but please, sir, I'm clean. We'll prove it. Well, how do you prove it if you haven't assessed your own situation? That's
Larry, if business owners are wanting to get in touch with you, how do they do that and get involved in this Back to Business Safe Reopening Main Street pilot project?
Okay. I left with...
Is there a website, though?
Yeah, I left with Danny an email address as well as a phone number to be able to reach myself.
All right. And so we'll forward that out.
Okay. Thank you so much.
If people ask. All right. Thanks so much, Larry. I really appreciate your time today.
My pleasure.
Have a great day. Larry Gold is the lead on the Bk2B, the Back to Business Safe Reopening at Main Street pilot project. He just wants businesses to check out, do an audit, an internal audit. How safe is this for getting people back to our businesses? And if you want, you can just email Kelly at 640toronto.com and we'll pass that information on to you to get in touch with him. All right, out to the roads for a look at the drive, 640 Toronto chopper traffic. Here is Richard Martin.